Hi and welcome to all the educators out there who continue to provide support for occupational therapy students on placements across Australia. My name's Alison Coleman, and on behalf of the SPEF-R project team, I would like to acknowledge the hard work and generosity of educators who offer placements in a wide variety of settings across the country and provide valuable learning opportunities for students with a diverse range of clients. The following vignettes you're about to see contain small snapshots of different scenarios that students may encounter as part of their placements, such as a team meeting or case conference in an acute mental health setting, a supervision session in a paediatric clinic, or a home visit in the community. In each of these scenarios, you'll see students all managing differently. You may wish to watch them more than once to give yourself an idea of how you feel each student is generally performing before you score them using the SPEF-R. In this scenario, we see Janine, a community-based occupational therapist, and her student Sam. They're visiting Beverly, a 75-year-old lady with osteoarthritis who lives at home. Her daughter Kathy is a nurse and has contacted her local community health centre with some concerns that Beverly is struggling with transfers. Sam is at the midway point of his placement.
Mrs Wilson, my name's Janine and I'm an occupational therapist from the Southern Community Health Centre, and this is my student Sam. We received a referral from your daughter Kathy, who's asked us to come today to see if there's anything we can do to help you around your home. Is that okay?
Yes, that's okay.
Can I offer either of you a tea or a coffee?
Oh, a cup of tea would be great. How about you, Sam?
No thanks, I don't drink tea or coffee.
Oh, how about a glass of water instead?
That sounds great, thanks.
No, I'll go get it, it's fine.
Thanks, darling.
Sam, do you have Mrs Wilson's file?
Yes, I have it here. Oh, no, wait. This one is Mrs. Wilson's file.
Oh, great.
Mrs Wilson, we have a few questions to go through with you today, but I might get Sam to ask them. Is that okay with you?
Yes, but I'm not sure what you can do for me, really. Kathy's worrying about my arthritis getting worse.
Well, actually, Mum, remember you do find it a bit difficult to get out of your chair with the pain in your hips.
Shall we start with that then, Sam?
Okay, so Mrs. Wilson, could you tell us a bit more about getting in and out of your chair?
Well, it hurts a bit when I try to get up.
Sam, maybe we could see how Mrs Wilson transfers on and off her chair.
Yeah, sure. Mrs. Wilson, would it be alright if you show us how you normally stand up from your chair?
Yes, Sam.
Oh no, that looks painful. Please sit that down. So Sam, what do you think we could recommend to make this a little bit safer and easier for Mrs Wilson?
Well, it looked very painful and a little unsafe for Mrs. Wilson. I'm wondering if there is something that we could change about the chair?
Mm-hmm.
But this is Mum's favourite chair.
Mrs Wilson, is this the chair you use most regularly throughout your day?
Yes, the children bought this for me.
Well, it looks like this chair is a bit low for you, Mrs. Wilson. Usually people find it a bit easier to get out of chairs that are a bit higher. How about we measure the chair to see if there's something that we could do for you?
Okay, Sam.
That'd be great. So what Sam will be doing is measuring the height of your chair and also the measurement of behind your leg.
Could you write down the measurements?
Yeah, no.
Okay.
What this will do is help us see if there's something we can do to change this chair to make it safer and easier for you.
Okay.
Oh, okay, dear.
So that's 43 centimetres?
Mm-hmm.
And 37 centimetres.
Mm-hmm. Sam, now that we have those measurements, do you have any recommendations for Mrs Wilson?
Well, I do know that chair raises may be an option for Mrs. Wilson. What do you think?
Yeah, that's good, Sam. Chair raises are one option. Maybe when we get back to the centre, you can have a chat to the technicians and gather some more information and give Mrs Wilson and Kathy a call later to discuss it further.
Yeah, sure, I'll do that.
Okay, great. So maybe we'll continue on with the rest of the questions.
How did you feel Sam was progressing in his placement?
We asked clinical educators and university academics from 5 states across Australia to rate Sam's performance in this vignette using 5 items from the SPEF-R. In this vignette, most participants agreed that Sam was an adequate student, with the majority giving him a rating of 3, which means he is demonstrating satisfactory performance at this stage of his placement. For item 4A.1 on Sam's SPEF-R, the majority of participants, 63%, gave him a rating of 3. For item 1.2 on the SPEF-R, the majority of participants, 71%, gave Sam a rating of 3. For item 4A.4, the majority of participants, 64%, gave Sam a rating of 3. For item 6A.5, the majority of participants, 63%, gave Sam a rating of 3. And for item 7A.1, the majority of participants, 68%, also gave Sam a rating of 3. So you can see for all 5 items on the SPEF-R, the majority of participants gave Sam a rating of 3, performs adequately at this point of his placement.
Hello Mrs Wilson, my name's Janine and I'm an occupational therapist from the Southern Community Health Centre, and this is my student Sam. We received a referral from your daughter Kathy, who has asked us to come here today to see if there's anything we can do to help you around your home. Is that okay with you?
Yes, that's fine.
Can I offer either of you a tea or a coffee?
Oh, I'd love a cup of tea. How about you, Sam?
I don't drink tea or coffee. I don't think caffeine is very good for you.
Oh. Well, how about a glass of water then?
Yeah, that's fine.
I'll go and get it, it's fine.
Thanks, darling.
Sam, do you have Mrs Wilson's file?
Yeah, it's in here somewhere. Oh no, this is Mrs. Milford's file, the lady with osteoporosis. I must remember to finish writing her notes. This one's Mrs. Wilson's file.
Mrs Wilson, we have a few questions to ask you about your home. Today I'm going to get Sam to go through these with you.
Yes, but I'm not sure what you can do for me, really. Kathy's worrying about me because my arthritis is getting worse.
But Mum, you do have a bit of trouble getting up out of your chair with the pain in your hips.
So Beverly, how are you going with your ADL tasks?
What? I beg your pardon? What's that?
Oh, you know, things like getting dressed and going to the toilet.
Actually, Sam, I think it might be best to talk to Mrs Wilson about her chair, as that seems to be something of higher priority.
Ah, okay.
Mrs Wilson, it sounds like it's a bit tricky for you to get in and out of your chair at times. Would it be okay if I asked you to show me?
Yes, dear.
Oh no, that's painful. Please sit back down. So Sam, what do you think we could recommend to Mrs Wilson to make this a little bit safer and easier for her?
Oh,
Do you think there's anything we could change?
well, we could try getting a chair from the kitchen.
This is Mum's favourite chair.
Do you think there's anything we can change about this chair?
Well, it looks like the chair is too low. Maybe we could measure it?
So what Sam is going to be doing is measuring the height of your chair and also the measurement of behind your leg.
So that's 35, 40...
Hold on, Sam. Sam, continue.
Oh, sure. Okay, and 30, 35.
So Sam, now that you have those measurements, is there anything you could recommend for Mrs Wilson?
No, I'm not really sure.
Well, actually, there are a couple of options. Do you have some time that we can discuss these with you now?
In this vignette, you can see from Sam's SPEF-R online placement summary page, all 75 participants agreed that he was not yet competent, with the majority considering him to be performing either marginally or unacceptably at this stage of his placement. For item 4A.1 on Sam's SPEF-R, 87% of participants gave him a rating of 1, unacceptable. For item 1.2, 97% of participants also gave Sam a rating of 1. For item 4A.4, 88% of participants gave Sam a rating of 1. For item 6A.5, 88% of participants gave Sam a rating of 1. And for item 7A.1, 88% of participants gave Sam a rating of 1. So you can see for all 5 items on the SPEF-R, the majority of participants gave Sam a rating of either 1, unacceptable, or 2, marginal at this point of his placement.
Hi, Mrs. Wilson. My name's Janine. I'm an occupational therapist from the Southern Community Health Centre, and this is my student Sam. We received a referral from your daughter Kathy, who has asked us to come today to see if there's anything we can do to help you around your home. She's asked us to come here today to ask you some questions about how you're coping. Is that okay?
Yes, that's fine.
Would either of you like a tea or a coffee?
Oh, a cup of tea would be great. How about you, Sam?
Oh, no thank you, but I'd love a glass of water.
No problem.
Oh, look, I'll get that. It's okay.
Thanks, darling.
Sam, do you have Mrs. Wilson's file?
Yes, it's here.
Mrs. Wilson, we have a few questions to ask you about your home. Today I'm going to ask Sam to go through them with you. Is that okay?
Yes, but I'm not sure what you can do for me. I'm fine, really. Kathy's just worrying about my arthritis getting worse.
But remember, Mum, you do find it a bit difficult to get out of your chair with the pain in your hips.
So that sounds a bit difficult for you, Mrs. Wilson. Is it only this chair that you have difficulty getting out of?
This is the chair I usually sit in. The kids gave it to me. It just hurts a bit when I get up.
Mrs. Wilson, could you please show us how you would normally stand up from your chair?
Yes, Sam, but...
Oh, that looks painful. And
Thank you.
Yes, don't worry about that.
Sam, what do you think we could recommend to make this a little bit easier for Mrs. Wilson?
Well, I'm thinking there might be something we can do about the height of the chair to make it easier for Mrs. Wilson. Would it be all right if I measured your chair?
Yes, okay, dear.
I'll just grab my tape measure. Oh, and just to let you know, I'll also need to measure the back of your leg to compare to the length of the chair.
Okay.
So I'm just going to kneel in front of you and I'll measure the chair leg first. So that's... And now I'm just going to measure the back of your leg. It'll be from the bottom of your heel to the back of your knee.
So Sam, now that you have those measurements, what would you recommend for Mrs. Wilson?
Well, I know there are a few options that might work, but I think chair raises may work in this particular instance. Chair raises are just things that go under the legs of your chair to make it a bit higher for you, so that your hips are higher than your knees. That makes it a lot easier and safer for you to stand up. Perhaps I could talk to the technicians back at the centre and see what they would recommend for you.
That sounds great, Sam. Maybe you can give Mrs. Wilson a call this afternoon and let her know what you recommend.
Sure. Okay. So Mrs. Wilson, would you prefer that I call you, or would you prefer I talk to Kathy?
Just talk to Kathy. She knows what's best.
Okay, just to check before we move on, would you like Sam to investigate chair raises, or would you like to discuss some other options?
I'd rather look at what we can do with this chair.
Yeah, that's fine. How about we go on with the rest of our questions?
You can see from this SPEF-R online placement summary page, all 75 participants agree that Sam was a competent student, with the majority considering him to be performing either proficiently or with distinction at the halfway point of his placement. For item 4A.1 on Sam's SPEF-R, the majority of participants, 99%, gave him a rating of 4 or above. For item 1.2, the majority of participants, 92%, gave Sam a rating of 4 or above. For item 4A.4, the majority of participants, 95%, gave Sam a rating of 4 or above. For item 6A.5, 91% of participants gave Sam a rating of 4 or above. And for item 7A.1, the majority of participants, 92%, gave Sam a rating of 4 or above. So you can see for all 5 items on the SPEF-R, the majority of participants gave Sam a rating of either 4, proficient, or 5, performing with distinction, at this point in his placement. Now you have seen how other educators across Australia have rated Sam in these vignettes, how would you rate his performances using the SPEF-R?
Thank you again for your ongoing contribution to the clinical education of occupational therapy students. I would like to thank Health Workforce Australia for providing the funding for this project, as well as all the actors, the film crew and members of the SPEF-R project team who were all involved in the creation of these vignettes that were filmed on location through the generosity of the Women's College at the University of Queensland.